A heart attack is a medical emergency, with similar symptoms in males and females. However, certain symptoms may be more common, depending on a person's sex. This video explores the symptoms of a heart attack for males and females, risk factors, and ways to prevent them. Symptoms of a heart attack. A heart attack occurs when the blood supply to the heart becomes blocked. Several symptoms may indicate a heart attack. These are chest discomfort or pain. A person may experience pressure, squeezing, fullness, or pain in the center of their chest. This may come and go or persist for more than a few minutes. Pain or discomfort in other body parts. A person may also experience pain or discomfort in one or both arms, the stomach, jaw, back, or neck. Shortness of breath. A person may feel a shortness of breath with or without chest pain. Some other heart attack symptoms may include cold sweat, nausea, feeling lightheaded, heart palpitations, sleep disturbances, fatigue. How do males and females describe symptoms? The Centers for Disease Control and Prevention, CDC, note that heart disease is the leading cause of death for males and females in the United States. Heart disease is an umbrella term that covers several heart conditions, including heart attacks. A 2019 study says the most common heart attack symptom is chest pain. However, the study notes that males are more likely to experience less common symptoms, such as heartburn, back pain, or indigestion-like pain. On the other hand, females may be more likely to experience a general feeling of unwellness or unexplained weakness. Research suggests females may also feel throat pain, neck pain, and nausea more frequently than males. Risk factors. Risk factors of a heart attack are similar between males and females. The American Heart Foundation lists the following as risk factors. Increasing age, being male, parents with heart disease, smoking, high cholesterol, high blood pressure, physical inactivity, living with obesity, diabetes, stress, alcohol intake, diet. Researchers are currently examining the idea that erectile dysfunction may also be a risk factor for heart problems, but the research is not conclusive. Complications. A 2018 study looks at the differences between males and females in depression levels and rates of complications following a heart attack. They found females were more likely to develop depressive symptoms and were more likely to experience complications. Some of the more common complications that people may experience after a heart attack include arrhythmias. Sometimes, a heart attack may disrupt the natural electrical rhythm of the heart, leading to arrhythmias. In these cases, a person may require a pacemaker until the rhythm returns to normal. Angina. A heart attack may damage blood vessels, resulting in the heart not getting enough blood supply. Doctors refer to this pain as angina and may prescribe medication to help prevent flare-ups. Heart failure. If a heart attack causes severe damage, a person may experience heart failure. Treatments for this include heart surgery or installing a pacemaker. Preventing a heart attack. Some of the risk factors associated with heart attacks are not reversible, such as sex and genetic risk of heart disease. However, a person can lower their risk of a heart attack by focusing on lifestyle changes, such as reducing or limiting alcohol intake. Low to moderate intake of alcohol may have some benefits for heart health. However, excessive drinking can damage the heart. Regularly exercising. Regular physical activity reduces blood pressure and the risk of death from a heart attack. Adopting a Mediterranean diet. Research suggests that people who consume Mediterranean diets may have better heart health. Stopping smoking. The National Heart, Lung, and Blood Institute note that the risk of heart problems decrease soon after people quit smoking. This risk continues to decline over time. Losing weight. Researchers link obesity to cardiovascular issues. Therefore, losing weight may reduce the risk of a heart attack. When to see a doctor. A heart attack is a medical emergency. If a person shows symptoms of one, they should seek medical help immediately. The American College of Cardiology Foundation note that 50% of people who experience a heart attack have early symptoms. By seeking help in the early stages, a person could reduce their risk of developing heart damage. Summary. Generally, males and females experience similar heart attack symptoms, which include chest pain or shortness of breath. However, males are also more likely to experience heart pain, back pain, or a feeling of indigestion. Meanwhile, females are more likely to experience a sensation of unwellness and unexplained weakness. People cannot change all their risk factors for a heart attack. However, they can lower their likelihood by adopting a healthful lifestyle, engaging in regular physical activity, stopping smoking, and limiting alcohol consumption. A heart attack is a life-threatening event caused by a disruption in the blood flow to the heart. Knowing the female-specific symptoms of a heart attack could help a person seek medical attention sooner, which may save their life. Women are less likely to survive their first heart attack than men. This may be because the symptoms differ between the sexes. Women are more likely to have a silent heart attack or display unusual symptoms. Also, female biology creates unique risk factors for heart attack, as some diseases that increase risk, such as polycystic ovary syndrome (PCOS), are not present in male biology. Symptoms of heart attack in women. Many people expect a heart attack to come on suddenly. But research suggests that women experience symptoms for several weeks before a heart attack. A study published in 2003 of 515 women who had experienced a heart attack reports 80% of women had at least one symptom at least 4 weeks before their heart attack. Symptoms may be constant or come and go, and they may also disrupt sleep. It is vital for a woman who experiences any of these symptoms to seek help immediately, as heart attacks can be fatal, regardless of whether symptoms are mild or severe. 8 of the symptoms of a possible heart attack are: 1. Chest pain. The most common symptom of heart attack in both males and females is chest pain or discomfort. It may be described as tightness, pressure, squeezing, aching. However, women can experience a heart attack without having any chest discomfort. Some 29.7% of the women surveyed in the 2003 study experienced chest discomfort in the weeks before the attack. Also, 57% had chest pain during the heart attack. 2. Extreme or unusual fatigue. Unusual fatigue is often reported in the weeks leading up to a heart attack. Fatigue is also experienced just before the event occurs. Even simple activities that do not require much exertion can lead to feelings of being exhausted. 3. Weakness. Feeling weak or shaky is a common acute symptom of a heart attack in a female. This weakness or shaking may be accompanied by anxiety, dizziness, fainting, feeling lightheaded. 4. Shortness of breath or heavy breathing without exertion, especially when accompanied by fatigue or chest pain, may suggest heart problems. Some women may feel short of breath when lying down, with the symptom easing when they are sitting upright. 5. Sweating. Excessive sweating without a normal cause is another common heart attack symptom in women. Feeling cold and clammy can also be an indicator of heart problems. 6. Upper body pain. This is usually non-specific and cannot be attributed to a particular muscle or joint in the upper body. Areas that can be affected include neck, jaw, upper back, or either arm. The pain can start in one area and gradually spread to others, or it may come on suddenly. 7. Sleep disturbances. Difficulty getting to sleep and unusual waking may be issues before a heart attack. Almost half of women in the 2003 study reported issues with sleep in the weeks before they had a heart attack. These disturbances may involve difficulty getting to sleep, unusual waking throughout the night, feeling tired despite getting enough sleep. 8. Stomach problems. Some women may feel pain or pressure in the stomach before a heart attack. Other digestive issues associated with a possible heart attack can include indigestion, nausea, vomiting. Heart attack. Post-menopause. The risk of heart attack increases due to falling estrogen levels after menopause. Post-menopause heart attack symptoms include pain or discomfort in the arms, back, neck, jaw, or stomach, rapid or irregular heartbeat, severe chest pain, sweating without activity. Risk factors. Risk factors for a heart attack in women include age. Those aged 55 years or older are at greater risk of heart attack. This may be because hormones provide some protection from heart disease before menopause. Family history. Those with a male relative who had a heart attack by the age of 55 years old, or a female relative who has had one by 65 years of age, are considered to have a family history of heart attack and are at increased risk. Health status. Certain markers, such as high blood pressure and high cholesterol, increases the risk of heart attack in both males and females. Medical conditions. Those with conditions, including diabetes, obesity, and autoimmune disorders are more likely to have a heart attack. Diseases such as endometriosis, PCOS, or a history of preeclampsia during pregnancy also increase risk. Lifestyle choices. Using tobacco or stimulant drugs, for example, cocaine or amphetamines, a sedentary lifestyle, or high levels of stress will all increase the risk of heart attack. When to see a doctor? The British Heart Foundation recommend all women over 40 years of age have regular checks with their doctor. This helps identify risk factors early so that they can be treated. Early intervention reduces the chances of a cardiac event. Anyone who notices the warning signs of a heart attack, such as the following, should see a doctor immediately. Unusual fatigue, shortness of breath, upper body pain. A doctor will note symptoms, check blood pressure and heart rate, and may order blood tests or use an electrocardiogram (EKG) to see the heart's electrical activity. When to call emergency services? Anyone who suspects symptoms of a heart attack should call emergency services immediately. Only 65% of women would call emergency services if they suspected they were having a heart attack, according to a 2012 survey. Emergency treatment can save lives. Anyone noticing the following symptoms should call an ambulance immediately, especially if the signs are present for 5 minutes or more. Chest pain or discomfort, pain in the upper body, including arms, back, neck, jaw, or shoulder, difficulty breathing, dizziness, extreme weakness, indigestion or heartburn, nausea, rapid or irregular heartbeat, shortness of breath, sweating, unexplained anxiety, vomiting. Prevention tips for better heart health include going for regular health checkups with your doctor, taking steps to manage other health conditions, including high blood pressure, high cholesterol, and diabetes, quitting smoking and avoiding tobacco in any form. Heart disease risk reduces by 50% just 12 months after someone quits smoking. Not using illegal drugs, especially stimulants, such as cocaine and amphetamines. Losing weight if overweight. Engaging in at least 30 minutes of aerobic activity, such as walking, every day. Eating a balanced diet and visiting a dietitian if necessary for dietary advice. Takeaway: a heart attack is a serious and potentially fatal medical event that requires emergency treatment. Women tend to display different heart attack symptoms than men. They also have additional risk factors. There are many steps women can take to reduce their risk of a heart attack. An awareness of the symptoms of heart attack, especially in the weeks before the event, can also improve outcomes and prevent complications.